Like any other community in Uganda's countryside, life moves at a very slow pace in Bugweri Bunama village, Kinu Parish, Namwenda sub-county in Kamuli District. The atmosphere, though, is in contrast with the determination of the residents. These are people whose parents, after getting tired of walking 13 miles to Namwenda Health Centre II, decided to build their health facility. Margaret Namundira, the LC1 chairperson of the village, was one of the people who contributed to the building of the health center in the 1990s. At the time, the chairperson was her husband, Samuel Chitamirike. She was the women's representative on his council.
The residents had a leader and they wrote a letter asking for the health center. And by then it was Dr. Muzira, who was the permanent secretary, who told them to get a place or a house where they will start from.
The letter listed the challenges the residents faced in accessing health care from a facility that was miles away. At the time, only a handful of the villagers had bicycles. This meant that if someone fell sick or had a sick child, he would have to walk 13 miles to the health center. That house was used for 3 years, and during this time, the Ministry of Health allocated health workers to treat residents in the facility. Renting was a temporary arrangement, though. The residents were determined to build their facility. Chitamirike donated an acre of land and encouraged the residents to form a group of 20 men, which was the core team constructing the health center.
Whereby wherever they needed something, they were the first people to contribute and to talk to the other residents that we should do this and this. They helped a lot.
The in-charge at Namwenda Health Centre IV constructed a shed where those attending the outpatient department could sit as they waited their turn in the treatment room.
People brought bricks, people brought sand, 7 tins each. They collected even hardcore stones.
Kinu Health Centre II has served the villagers well. However, they are now calling on the government to upgrade it to a third-tier health facility so that they can access more services.
On weekends, we don't get services. They only work from Monday to Friday. They start at 8 to 5. And remember, I said the rainy seasons, they come late, which means they may start at 11.
Although it provides antenatal services, it does not have a labor ward. Pregnant women have to make the long journey to Namwenda Health Centre IV to give birth.
When the child is delivered, passes on because of tiredness. Then some women deliver on the way, even if it is night time.
Kinu Health Centre II has only 3 health workers to cater to an annual clientele of 16,000 people. Another sticking point is the lack of housing for the health workers. While thanking the government for setting up the health facility in the parish, Mary Namlondo, the in-charge of Kinu Health Centre II, decries the lack of drugs and other services.
So most of the people come from Buyende, Kaliro and Luka. They come here for services. So if Kinu is uplifted, we believe we shall be able to get more commodities and we shall be able to reach everyone as expected, because the staff will be added on and the accommodation will be provided.
What this means is that several women in the parish still give birth in the homes of traditional birth attendants, or TBAs.
And yet one of the strategies of the government is to reduce the burden of disease, in other words, morbidity and mortality. That's maternal and neonatal.
The Ministry of Health statistics show that the Busoga sub-region, under which Kamuli District falls, records 93 maternal deaths per 100,000 live births. This is well above the national average of 82 deaths per 100,000 live births. Residents who fall ill over the weekend have taken to buying drugs from drug shops and stocking them at home. In 2020, the district health officer visited the health facility and advised them not to bother taking on the burden of constructing staff quarters. The AIDS Education Group for Youth under Twaweza Uganda conducted research in the village and advised the residents to list the 6 major social problems that they cannot solve for themselves. 2 of the problems were the health center and the deteriorating condition of the road connecting the village to Namwendwa sub-county.
They have brought back this thing of Bulungibwansi. They are not waiting on the government. We have communities which have come together and they have built latrines for the schools. That is in Butaga. We have another community that has, where a citizen still donated land to the community for a vocational school.
In 2022, the district authorities sent a tractor to carry out some maintenance work on the road. Now the road is in a deplorable state, and when it rains, it's impassable. To compound matters, the residents say the village does not have a village health team to offer first-line treatment. The attitude of the residents of Bugweri Bunama village is commendable. However, now is the time for the government to stand with them and elevate their health center to a 3rd-tier facility to improve healthcare access and service delivery.